Warfarin is what's known as an anticoagulant medicine. It's used to slow down the time it takes your blood to clot. It can be used for many different conditions, including blood clots within your lungs, which are known as pulmonary embolisms, or blood clots in your legs, known as deep vein thrombosis. It can also be used to reduce the risk of stroke in certain heart rhythm disturbances, for instance atrial fibrillation. Whilst warfarin is very effective for these conditions, there are some important pieces of information that patients need to be aware of so that we can use it safely as well as effectively. If you're to be started on warfarin, it's important for your doctor to know what other medicines you're taking, if you've ever had any bleeding problems in the past, and if you're susceptible to falls or if you get confused quite easily with your medicines. Each patient, when they're started on warfarin, will receive an anticoagulant pack. This is a yellow booklet which contains information about warfarin treatment. It includes an anticoagulant record therapy book, which is extremely important to take with you when you go to any clinics for anticoagulant checks, and it also contains an alert card which can be used to show to any doctor or chemist that you take warfarin. Warfarin is available as different strength tablets, however they are colour coded, so for instance 1 mg tablets are always brown, 3 mg tablets are always blue, and 5 mg tablets are always pink. Routinely at discharge and in the outpatient setting, we use 1 mg or brown tablets and 3 mg or blue tablets. However, when you first start taking warfarin, you may well receive the pink 5 mg tablets. Whilst you're taking warfarin, you'll have to have regular blood tests done to see how fast or how slow your blood clots. The test that we do is called an INR, which stands for International Normalised Ratio. For most conditions, the INR should be between 2 and 3. If the INR is below 2, that means that your blood clots a little bit too quickly and you need more warfarin. If your INR is above 3, then your blood clots too slowly and you need a little bit less warfarin. For some conditions, the INR range might be 3 to 4 or even 4.5. This information will be recorded in your anticoagulant record book. When you're taking warfarin, you need to have your INR checked regularly because the response you will have to warfarin will vary over time, and it's important that we keep the INR within the range as much of the time as we possibly can. We normally say to take warfarin tablets around about tea time every day. It doesn't matter whether it's before food or whether it's after food. With regards to the dose, the anticoagulant record book will tell you what dose you're supposed to take, and that will be expressed as a number of milligrams and not number of tablets. If you miss a dose, first thing to do is not to worry. If you remember the same evening before you go to bed, then just carry on with your normal dose as usual. If it's the next day when you think you've not taken the warfarin, in that case don't double the dose, just take your normal dose at tea time, but make a note that you forgot to take it in your anticoagulant record book, particularly if you're coming up to a clinic appointment, because that might affect the INR result that they get at clinic. Lots of medicines interfere with warfarin. Some make it work too much and some make it work not enough. Anything that you've prescribed at the moment will have been taken into account. However, if you go to the GP to have any medicines prescribed, or if you go and buy any medicines over the counter, always tell the GP or the pharmacist that you take warfarin. Wherever possible, we'll use a medicine that won't interfere with the warfarin. However, sometimes that's not possible and we have to use a medicine that could increase or decrease the effect of the warfarin. In this situation, it might be necessary to ask you to come back to the anticoagulant clinic to check your INR earlier than what was planned. Alcohol and some foods can also affect the way that warfarin works. Alcohol in particular can be a problem. What we would usually advise is a small amount of alcohol, 1-2 units a day, won't interfere with the warfarin. However, any more than that can make the INR go too high, which increases your risk of bleeding problems. So, what we would suggest is that you restrict your alcohol intake to no more than 1 or 2 units a day. Don't think you can save all the units up and have them in one go, because that's very, very dangerous as well. With regards to food, some foods do interfere with warfarin, in particular things like green leafy vegetables, broccoli, avocados. Things that are high in vitamin K can reduce the effect of warfarin. However, the amounts that you'd have to eat for that to be apparent are quite large. So if you just carry on with your normal diet, don't make any radical changes to what you eat, everything should be okay. Cranberry juice can increase the effects of warfarin, and therefore, if you're taking warfarin, you should avoid drinking cranberry juice. The main side effects that you need to be aware of whilst taking warfarin is the obvious one. We're giving you a drug to stop your blood clotting as quickly, so if you cut yourself, you'll notice it'll take longer to stop bleeding. It should stop bleeding eventually, but it might take 2 or 3 times longer than normal. Use usual first aid measures to stop the bleeding, apply pressure, elevation, and the bleeding should stop fairly quickly. If, however, you injure yourself quite badly and you're bleeding very heavily, or you get sudden onset of nosebleeds, particularly nosebleeds lasting for longer than 5 minutes, bruises appearing when you don't remember injuring yourself, blood in your water, blood in your motions, anything like that, then they could be warning signs that your blood's a little bit too thin. In that case, either get in touch with the anticoagulant clinic if it's during office hours, or alternatively, go to A&E at the hospital. We'll do a quick blood test. If your blood's too thin, we'll give you something to reverse it and address the bleeding. Following the advice in this video will ensure your warfarin is used both safely and effectively. If you have any further questions, please ask your doctor, pharmacist or nurse.